Headquartered in Akron, Ohio, SummaCare is one of the region's only provider-owned health insurance companies. We were formed by doctors who truly understand the needs of the communities we serve. We value the relationship between our members and their doctors. Through our network of thousands of the area's finest providers, we're able to offer high-quality, coordinated care that is focused on you. As a local health plan, we're proud to serve our friends and neighbors and offer Medicare options designed to help you stay healthy. Medicare is a federal health insurance program for people age 65 or older, people under age 65 with certain disabilities, and people of all ages with end-stage renal disease. Medicare includes 4 components. Part A is hospital insurance. Part B is medical insurance. Part C is Medicare Advantage plans. And Part D is prescription drug coverage. With Part C, Medicare Advantage plans, you get all your Medicare Part A and Medicare Part B coverage through the insurance company instead of directly through the government. Medicare Advantage plans that include Part D drug coverage can give you all your Medicare benefits in one plan. There is no need to purchase additional coverage such as a Medicare supplement or Medigap plan or a prescription drug plan. SummaCare is a Medicare Advantage plan. SummaCare's Medicare Advantage plans offer more coverage and lower out-of-pocket costs than original Medicare. For instance, our plans have a capped annual out-of-pocket limit, so you will always know the maximum cost you'll pay if something unexpected happens, like an extended hospital stay. Original Medicare has no limit to your out-of-pocket costs. SummaCare plans also include prescription drug coverage as well as extra benefits not offered by original Medicare, such as free gym memberships through the Silver Sneakers program. Original Medicare provides Part A, hospital coverage, and Part B, medical coverage. Original Medicare does not cover all of the costs associated with these services. Medicare Supplement or Medigap insurance are plans which pay some of the costs that Original Medicare doesn't cover, such as co-payments, co-insurance, and deductibles. For example, Original Medicare may cover 80% of a hospital stay. If you enroll in a Medicare supplement plan, it may cover the remaining 20% of the hospital stay. Most Medicare supplement plans don't include prescription drug coverage. This must be purchased separately at an additional premium. SummaCare Medicare Advantage plans include Medicare Part A and Part B coverage and also prescription drug coverage. Also included are wellness tools and programs designed to help you feel your best, including the Healthy You program. More on that later. To enroll in a SummaCare Medicare Advantage plan, you must be enrolled in Medicare Parts A and B, and you must continue to pay your Medicare Part B premium every month. You must reside in our 41-county service area. In most instances, if you have end-stage renal disease, you are not eligible to enroll in a SummaCare Medicare Advantage plan. If you have end-stage renal disease, you'll usually get your health coverage through Original Medicare. Please contact us for more information about enrollment if you have end-stage renal disease. You are also not eligible to enroll in SummaCare if you do not live in our service area, or you are not eligible for one of the following enrollment periods. For most people turning 65, you're eligible to enroll in a SummaCare Medicare Advantage plan during a 7-month period that begins 3 months before your birthday and ends 3 months after your birthday. Most people review their coverage during the annual enrollment period. This runs from October 15th through December 7th of each year. This is usually the only time of year you can make changes to your coverage, unless you are eligible for a special election period. A special election period is a time outside the annual enrollment period when you can make changes to your Medicare coverage. It is based on certain events happening in your life. Such events might include moving, losing other insurance coverage, or becoming eligible for both Medicare and Medicaid. SummaCare offers 4 plans. 2 are HMO, and 2 are HMO with a point of service or POS option. You are covered anywhere in the country for emergency and urgent care services and up to $25,000 per year for emergency services worldwide. You'll have the peace of mind knowing you're covered in an emergency or urgent situation no matter where you are. For other covered services, our HMO plans give you access to the SC Medicare network of doctors and hospitals. Please note the provider network may change at any time. You will receive notice when necessary. Our HMO POS plans offer coverage through any Medicare-approved provider, inside or outside of the SC Medicare network. You should note that your out-of-pocket costs may be higher if care is received from providers outside of the SC Medicare network. All plans offer a maximum out-of-pocket benefit designed to limit your expenses in any given calendar year. When your out-of-pocket expenses, including copays and co-insurance for in-network services, reach a specified amount, the remainder of your eligible expenses for the rest of the calendar year are paid by SummaCare at 100%. You pay $0 for these services. All plans feature a $0 deductible on medical services. The Topaz plan offers a $0 monthly plan premium. Note, you are still required to pay your Medicare Part B premium. Our other plans offer coverage for low monthly premiums. All plans feature a $0 copay for in-network primary care physician visits. All plans include prescription drug coverage. SummaCare offers hundreds of Tier 1 preferred generic drugs for a $0 copay. In addition, most preventive care services, including flu shots and wellness exams, are covered for a $0 copay. You'll even have access to the Silver Sneakers Fitness Program, which offers free gym memberships to many area fitness locations at no additional cost to you. And new for 2017, all plans will include coverage for preventive dental services and a prescription eyewear allowance. As we mentioned, prescription drug coverage is included with all SummaCare Medicare plans at no additional cost. There are some important things you need to know about prescription drug coverage. When shopping for prescription coverage, you've probably heard the terms coverage gap or donut hole. This happens when you experience a gap in Medicare prescription drug coverage and pay more out-of-pocket costs on medications while in this gap. Not everyone will reach this coverage gap or donut hole. It occurs when you and your prescription drug plan together reach total prescription drug costs of $3,700 in one calendar year. Here's how it works. First, you meet your deductible for pharmacy coverage. Most SummaCare plans feature a $0 deductible for pharmacy coverage. Please note there is a $150 deductible for drugs in Tiers 3 and 4 for the Topaz plan. During the calendar year, you pay predictable copays or co-insurance on your prescriptions based on the tier the drug is assigned within our formulary. When your year-to-date total drug costs reach $3,700, including what you've paid in copays and co-insurance, plus the amount your prescription drug plan has paid to the drug manufacturer, you will enter the coverage gap or donut hole. Not everyone will enter this phase. If you do enter this phase, keep in mind that all SummaCare plans continue to offer Tier 1 preferred generic medications at a $0 copay. In short, there is no gap in coverage for SummaCare Tier 1 preferred generic drugs. While in the coverage gap or donut hole, out-of-pocket expenses on prescriptions may increase and your copays will no longer apply. To help reduce your costs, discounts and plan payments will apply to all your prescriptions. For brand-name drugs, you'll pay 40% of the cost and 51% of the cost for generic drugs. If you receive extra help for prescriptions, your copays may be even lower. Remember, SummaCare members pay a $0 copay for Tier 1 preferred generic drugs, even while you're in the coverage gap or donut hole. On the other side of the donut hole is catastrophic coverage. If you reach this phase, your benefits actually increase. It is designed to help individuals with extremely high drug costs. You reach this stage when your total year-to-date out-of-pocket drug costs reach $4,950. If you reach this phase, you pay only a small co-insurance or copay for each covered drug for the remainder of the year. In addition to medical, hospital, and prescription drug coverage, SummaCare Medicare Advantage plans include a variety of extras designed to help you live a healthier life. We all know the importance of prevention. That's why all of our plans include many important preventive exams, screenings, and vaccines for a $0 copay. Your coverage will also include Healthy You. These valuable extras are available to you at no additional premium cost and includes tools you can use to stay healthy and feel your best, such as the Silver Sneakers Fitness Program, SummaCare's 24-hour nurse line, Health Manager powered by WebMD, preventive health reminders to ensure that you're getting needed checkups. Additional Healthy You services, including many enhanced disease management programs, are also available to SummaCare members. You can also add optional supplemental dental coverage through Delta Dental of Ohio to your plan for an additional $25 per month. This can be added at the time of application or up to 30 days after your effective date of coverage. Delta Dental benefits include preventive, comprehensive coverage with no deductible, no waiting period, with maximum benefits of $1,500 per year. If you purchase this optional supplemental coverage through Delta Dental, it will replace the preventive dental coverage included with your plan. It will not be in addition to the preventive coverage included with your plan. Enrollment is easy. You can fill out an application and mail it to us. You can call us on the phone. You can apply online. Or you can visit us in person at a Talk About seminar, whatever works best for you. As a SummaCare Medicare Advantage member, you will enjoy many benefits focused on your health and wellness. And you will only need to carry one card, your SummaCare Member ID card. It's all you need at the doctor, at the pharmacy, and at the hospital. Let's get started today.